What is a stroke? A stroke is a type of injury to the brain. Following the same concept of a heart attack, a stroke is a brain attack. It occurs when vital blood flow and oxygen is cut off from the brain. The lack of oxygen to the brain causes brain cells to die after a few minutes. This in turn causes brain damage that may be long-term and in some cases permanent. There are two types of stroke, and they are ischemic stroke and hemorrhagic stroke. Ischemic strokes occur as a result of an obstruction within a blood vessel that supplies blood to the brain. There are two types of ischemic stroke. In both types, an artery of the brain is blocked, which restricts blood flow to the brain. The first, thrombotic, occurs when a blood clot or a thrombus forms and restricts blood flow in an artery that supplies blood to the brain. The brain tissue in which the artery supplies blood to becomes starved or ischemic, which causes brain tissue to die. The second type of ischemic stroke is embolic. In an embolic stroke, a blood clot or plaque that was formed elsewhere, which is also known as an embolus, travels through the bloodstream to an artery in the brain and restricts blood flow in that manner. In 2010, stroke was the primary cause of over 3,000 hospital inpatient admissions in Hawaii. Of these, 63% were ischemic strokes. Nationally, 87% of all strokes are ischemic. Hemorrhagic strokes occur when a weakened blood vessel ruptures. There are two types of hemorrhagic strokes. In both types, blood bleeds into the brain and disrupts blood flow. The bleed creates pressure on brain cells and damages them. The first type is an intracerebral hemorrhage, which occurs when an artery in the brain bursts and floods the surrounding tissue with blood. The brain tissue in which the artery supplies blood to becomes starved and causes the brain tissue to die. The second type is a subarachnoid hemorrhagic stroke, which occurs when a weak spot in a blood vessel wall, which is also known as an aneurysm, bursts. Blood bleeds into the tight space between the brain and the skull. The pressure that the bleed creates results in damage to brain tissue. So what? Why is it important? Stroke is a leading cause of adult disability. It is the third leading cause of death in Hawaii, and annually, stroke claims over 600 lives in Hawaii. Nationally, about 800,000 people in the US have a stroke each year. Every 40 seconds, someone in the US has a stroke. Every 4 minutes, someone in the US dies from a stroke. By the end of this presentation, 15 people in the US will have experienced a stroke and 2 of them will have died. And what's most heart-wrenching is that 80% of all strokes are preventable. Prevalence of stroke in Hawaii. In a 2012 report conducted by the Hawaii State Department of Health, it was stated that the prevalence of stroke was highest among Caucasians and Japanese, and in Hawaii residents that were most vulnerable. Vulnerability being measured as those with a high school education or less, those with lower household income, and those that are unemployed, retired, or unable to work. They also found that stroke mortality rates were highest in the counties of Hawaii and Kauai. Biological markers. Some biological markers include changes in vision, sleep patterns, incontinence, paralysis, pain, fatigue, dizziness and vertigo, and challenges with speech. Psychological markers. Some psychological markers include increased feelings of depression, hopelessness, and low self-esteem, frustration, anxiety, stress, anger, apathy, lack of motivation, changes in the thought processes in regards to attention span, memory, problem solving and organization, loss of control of emotions, and in rare cases, changes in personality. Sociological markers. Stroke may change the individual's mobility and social capabilities, which may cause them to withdraw from participating in social activities. This can affect the individual's role in the family, can push the individual into isolation, and can create strains in relationships. Role of the social worker. As an educator and broker, the social worker works to inform clients and their families about the resources that are available in their community and linking them with those resources. A program that is available to individuals who have experienced a stroke is the Stroke Rehabilitation Program. It is conducted through the Rehabilitation Hospital of the Pacific, otherwise known as Rehab or RHOP. RHOP strives to help patients reach their highest potential by providing one-to-one services and tailoring treatment to the patient's needs and goals. It is the only accredited inpatient rehabilitation facility in Hawaii. RHOP's medical staff is a multidisciplinary team with specializations that include physical medicine and rehabilitation, internal medicine, occupational medicine, and psychology. Some of the services that RHOP provides include physical therapy, occupational therapy, and speech therapy. For recreational purposes, RHOP provides art therapy and aquatic therapy. RHOP has an innovation center that is equipped with state-of-the-art technology. It includes a driving simulator program and a neurorobotics program. RHOP provides both inpatient and outpatient care. Currently, RHOP has 3 outpatient clinics, 2 located on Oahu in Nuuanu and Aiea, and 1 on Hawaii Island in Hilo.